Can you improve your glomerular filtration rate? GFR. Can you improve your glomerular filtration rate, GFR? Every single day, your kidneys quietly filter more than 50 gallons of blood. 50 gallons. And yet, millions of older adults are watching their GFR slip lower year after year without even realizing it. But here is the part no one talks about. Many people are trying their best and still seeing their kidney numbers move in the wrong direction. They cut out salt. They drink more water. They avoid red meat. They take their medications on time. And still, their urine looks foamy, their ankles swell, and their blood pressure creeps up. Why does this keep happening? They are cutting back on coffee. They are watching every gram of protein. They are choosing whole grains. They are taking their supplements. They are doing everything the internet tells them to do. And yet, the numbers do not improve. If anything, they slowly get worse. But here's the twist. There is one quiet mistake almost everyone overlooks. It is not dramatic. It is not painful. It is not obvious. But it adds stress to your kidneys day after day. And most people never connect the dots. Think of your kidneys like two tiny filters that read the signals your body sends. Every sip you take, every bite you eat, every medication you swallow sends a message. And your kidneys react within minutes. When the message is wrong, even something small can disrupt your filtration rate. If that signal triggers inflammation or pushes extra waste into the bloodstream, no healthy dinner or clean eating later in the day can reverse the strain. That tiny mistake can burden your kidneys for years before symptoms ever appear. So today, I want to cut through the confusion. No fluff, no fear-based myths, just clear, science-based guidance that helps you understand how GFR works and what actually supports it. And we will start with the practical changes that protect your filtration rate and reduce stress on your kidneys. Let's move into the first major step you can take to support a healthier GFR and protect your kidney function. Eating well is one of the most powerful ways to protect your kidneys and support a healthier GFR. When you choose the right foods, you reduce the workload on your kidneys and give them the environment they need to function more efficiently. Your kidneys filter the minerals, salts, and waste that come from the foods you eat. When sodium, potassium, protein, or phosphorus are too high, your kidneys must work harder to process them. Over time, this extra strain can lower your filtration rate. Certain nutrients, like vitamin D, also play an important role. Studies have shown that low vitamin D levels are linked to a lower eGFR because vitamin D affects how your body balances minerals and supports healthy kidney tissue. But even good foods can become a problem when they are eaten in excess. Too much sodium can raise your blood pressure. Too much potassium can be harmful if your kidneys are already struggling. Eating large amounts of protein, especially animal protein, can increase waste products that the kidneys must filter. And phosphorus from processed foods can build up quickly. If you have kidney disease or diabetes, you need to be even more cautious because your kidneys may not clear excess minerals the way they used to. So how do you eat in a kidney-friendly way without feeling restricted? I recommend focusing on balance and portion control. Choose fresh foods over processed ones. Season with herbs instead of salt. Keep protein to moderate portions, unless your doctor gives different instructions. Include more vegetables that are naturally lower in potassium. And choose whole, simple ingredients whenever you can. If you are not sure what to eat, the DASH diet, Mediterranean diet, and whole food plant-based patterns are all supported by research for kidney health. A dietitian can help tailor these to your personal needs. You can also make small variations to keep your meals enjoyable. Try swapping high-potassium fruits like bananas for apples or berries. Replace red meat with fish or plant proteins a few times a week. These changes lighten the load on your kidneys while still giving you the nutrients you need. Before we move on, remember that some supplements and fortified foods contain hidden minerals. If you are taking vitamins or herbal products, talk with your healthcare provider to make sure they are safe for your kidneys. I am Dr. Matthias from Kidney Health 365. If this is helpful, make sure to like this video and subscribe so you do not miss the next steps in protecting your kidneys. Now let's look at the next major factor that influences your GFR and why your heart health plays a much bigger role than most people think. Keeping your heart strong is one of the most important steps you can take to support a healthier GFR. When your heart pumps blood smoothly and your blood vessels stay open, your kidneys receive the steady circulation they need to filter waste effectively. Your heart and kidneys work as a team. When blood pressure rises, the blood vessels leading into the kidneys become narrow and stiff. This reduces the amount of blood reaching the glomeruli, the tiny filters inside your kidneys. Over time, this reduced blood flow lowers your filtration rate. Regular physical activity helps relax your blood vessels, improve circulation, and lowers blood pressure. This simple change can make a meaningful difference in how well your kidneys filter waste. But there are risks when heart health is ignored. High blood pressure is one of the leading causes of chronic kidney disease. Many people do not feel symptoms until damage has already begun. Too much sodium, long periods of sitting, unmanaged stress, and smoking all make the problem worse. If you have heart disease, diabetes, or a history of stroke, you need to be even more careful because your kidneys are more vulnerable to changes in blood pressure. So how can you support your heart in a safe and kidney-friendly way? Start with gentle, consistent movement. A 20 to 30-minute walk most days of the week is enough to improve blood flow. If walking is difficult, try chair exercises, light stretching, or simple at-home routines. Focus on slow, steady breathing to calm your nervous system and keep your heart rate balanced. Choose foods that support heart health, such as berries, leafy greens in moderation, and healthy fats like olive oil. And limit high-sodium meals that can raise your blood pressure. You can also make variations to keep your routine enjoyable. Try walking in a nearby park instead of on a treadmill to reduce stress. Or add a short morning stretching session to help your blood vessels open up before the day begins. These small adjustments help your heart work more efficiently and send healthier blood flow to your kidneys. For those taking medications for blood pressure or heart disease, follow your doctor's instructions closely. Never stop or adjust your dose on your own. Some heart medications need consistent timing to work correctly. If you have never tried any of these heart-friendly habits, comment 0 below. If you are already doing some of them, comment 1. I would love to know where you are on your journey. In the next section, we will look at how managing your blood sugar plays a powerful role in protecting your filtration rate and preventing silent kidney damage. Managing your blood sugar is one of the most effective ways to protect your kidneys and support a healthier GFR. When your blood sugar stays stable, your kidneys face less stress and can filter waste more efficiently, especially if you are living with diabetes or prediabetes. Your kidneys work hard every time sugar enters your bloodstream. When blood sugar stays high for long periods, the tiny blood vessels inside the kidneys become irritated and damaged. This affects the glomeruli, the filtration units that determine your GFR. Over time, high glucose levels thicken these vessels, reduce blood flow, and allow more waste to build up in your system. By keeping your blood sugar in a healthy range, you protect these delicate filters and slow down the progression of kidney damage. But there are real risks. When blood sugar is not well controlled, people with both kidney disease and diabetes tend to experience complications earlier and more severely. High blood sugar can lead to inflammation, nerve damage, vision problems, and a faster decline in kidney function. Many older adults do not feel symptoms until the damage is already happening. Foods with hidden sugars, large carbohydrate portions, and long gaps between meals can all cause unexpected spikes that strain your kidneys. So how do you manage your blood sugar in a kidney-friendly way? Start with mindful eating. Choose balanced meals that include lean protein, vegetables that are lower in potassium, and small portions of whole grains. Spread your meals throughout the day instead of eating one heavy meal. Monitor your blood glucose as recommended by your doctor, especially if you take insulin or diabetes medications. Gentle, daily movement, like walking after meals, can help your body use sugar more effectively and prevent spikes. Drink water regularly, but always follow your doctor's fluid recommendations if you have advanced kidney disease. You can also try simple variations to help keep your blood sugar steady. Swap sugary snacks for a handful of blueberries or a small apple. Replace white bread or pastries with oatmeal or whole grain toast in moderate portions. These swaps digest more slowly and help prevent sudden increases in blood sugar. If you take medications for diabetes, follow your doctor's instructions closely. Some medications may require dose adjustments if your kidney function changes. Never change your dose on your own. And always report unusual symptoms like dizziness or frequent lows. If you have never practiced any of these blood sugar habits, comment 0 below. If you are already paying close attention to your blood sugar, comment 1. I want to know how you are taking charge of your kidney health. In the next section, we will look at how staying hydrated in the right way can help your kidneys filter waste more efficiently without putting extra strain on them. Drinking the right amount of water is one of the simplest and most effective ways to support your kidneys and maintain a healthier GFR. When you stay properly hydrated, your kidneys can filter waste more smoothly and regulate your urine more efficiently. Water is the tool your kidneys use to flush out toxins. When you do not drink enough, your blood becomes more concentrated, and your kidneys must work much harder to remove waste. Over time, this extra strain can lower your filtration rate. Research suggests that for many people with kidney concerns, drinking about 1 to 2 liters of water a day can support better kidney function. But hydration is not only about drinking more, it is about drinking the right amount for your stage of kidney health. There are risks when hydration is misunderstood. Drinking too much water can be just as harmful as drinking too little, especially if you already have moderate or advanced kidney disease. When the kidneys can no longer remove excess fluid, the extra water stays in your body. This can lead to swelling in your legs, shortness of breath, and pressure on your heart. For many older adults, this buildup appears slowly, and they do not realize the problem until symptoms become noticeable. People with heart failure, uncontrolled high blood pressure, or late-stage kidney disease need to be especially careful. So how do you hydrate safely? Start by drinking small amounts throughout the day instead of large amounts at once. Pay attention to the color of your urine. A light yellow usually means you are well hydrated. Avoid sugary drinks, fruit juices, and soda, because they can raise blood sugar and add unnecessary strain to your kidneys. If your doctor has given you a fluid restriction, follow it closely. If not, aim for steady hydration in the range recommended for your health condition. If you sweat more during exercise or hot weather, replace only the amount you lose, not extra. You can adjust your routine in small ways to stay hydrated comfortably. Try adding a slice of lemon or a few berries to your water for a mild flavor without added sugar. Or sip warm water in the morning to wake up your digestive system and help your kidneys start their day gently. These small habits make hydration more enjoyable and easier to maintain. For those who have never paid close attention to their hydration, comment 0 below. If you are already monitoring your water intake daily, comment 1. I would love to see where you are in your kidney health journey. Next, we are moving into a section many people overlook, yet it plays a major role in protecting your filtration rate. The medications you take every day and how they affect your kidneys. Talking with your doctor about the medications you use every day is one of the most important steps you can take to protect your kidneys and support a healthier GFR. Some medicines are essential for your health, but others can quietly place extra stress on your kidneys without you realizing it. Your kidneys process almost everything you swallow: pain relievers, antibiotics, diabetes medications, acid reducers, statins, and even erectile dysfunction medications must all pass through the kidneys in some form. Certain drugs, known as nephrotoxic medications, can narrow blood vessels, reduce blood flow to the kidneys, or cause inflammation inside the tiny filters that determine your GFR. When these medicines are used too often, at high doses, or without medical guidance, they can gradually lower your filtration rate over time. But there are real risks when medication use is not monitored carefully. Many people take over-the-counter pain relievers like ibuprofen or naproxen for years without knowing they can strain the kidneys. Others use supplements or herbal products that seem natural but contain hidden minerals or compounds that affect kidney function. If you already have kidney disease, diabetes, or high blood pressure, the impact can be stronger, and symptoms may stay hidden until the damage has already begun. Some medications also need dose adjustments when kidney function changes, and ignoring these adjustments can lead to even more complications. So how do you use medications safely? Start by keeping an updated list of all your prescriptions, over-the-counter drugs, vitamins, and herbal supplements. Share this list with your doctor or pharmacist at every visit. Ask whether any of your medications can affect your kidneys and whether safer alternatives exist. Never stop or change the dose of a medication on your own. If you experience swelling, fatigue, dizziness, or changes in urination, mention it early. These are signs your kidneys may be responding to a medication. When possible, use the lowest effective dose for the shortest necessary time. Small actions like these protect your kidneys from unnecessary stress. You can make simple variations to reduce your reliance on certain medications. For example, instead of taking pain relievers daily, try gentle stretching or heat therapy for joint discomfort. If heartburn is an issue, reduce late-night meals or caffeine before turning to long-term acid reducers. These small shifts can reduce how many medications your kidneys must process. If this is the first time you have reviewed your medications with a kidney-focused perspective, comment 0 below. If you already track your medications and talk with your doctor regularly, comment 1. I would love to know how proactive you are becoming in protecting your kidneys. Now that we have covered how your diet, heart health, blood sugar, hydration, and medications influence your GFR, let's move into a critical question many people overlook when it comes to kidney disease. When should you see a doctor? There are times when your body gives you quiet signals that something is not right with your kidneys. And recognizing these signs early can make a meaningful difference. Many older adults overlook these symptoms because they seem mild or unrelated. But your kidneys often whisper before they shout. One important sign is a change in your urine. If your urine becomes foamy, if you see blood, or if you suddenly start urinating far more or far less than usual, it may be your kidneys asking for attention. Unexplained itching, swelling in your ankles or around your eyes, muscle cramps, fatigue, and trouble sleeping are also common early indicators that something may be affecting your kidney function. These symptoms can appear slowly, and many people ignore them until they become stronger. It is especially important to seek medical guidance if you have a family history of kidney problems, high blood pressure, or diabetes. Even if you feel well, these conditions place extra stress on your kidneys. Many people discover kidney disease during routine blood work, long before symptoms appear. That is why regular checkups matter, especially as we get older. If you experience any of these changes, do not wait. A simple conversation with your healthcare provider can help identify problems early and prevent more serious complications. Early detection gives you the chance to protect your GFR and slow the progression of kidney damage. With that in mind, understanding how kidney function is actually measured becomes even more important. Let's take a closer look at the tests doctors use to evaluate how well your kidneys filter waste and what those numbers truly mean for your health. One of the most common ways doctors check your kidney function is through the estimated GFR, often called eGFR. This test is simple, widely used, and built into routine blood work, which means many people learn about their kidney health through this number long before symptoms appear. The eGFR gives a general picture of how well your kidneys are filtering waste by using markers in your blood, mainly creatinine or sometimes cystatin C. Creatinine is a natural waste product from muscle activity. When your kidneys are working well, they remove creatinine consistently. But when kidney function slows down, creatinine builds up in the bloodstream. The eGFR formula uses your creatinine level, age, sex, and in some cases, other factors to estimate how efficiently your kidneys are filtering. It is quick, accessible, and extremely useful for early detection. But like any estimate, it has limitations. Creatinine levels can vary from person to person depending on muscle mass, hydration, medications, and even diet. Someone who is very active or muscular may appear to have lower kidney function than they truly do. Meanwhile, An older adult with low muscle mass may have normal creatinine levels even if kidney damage is starting. That is why your doctor looks at trends over time rather than a single reading. Even with these limitations, the eGFR remains an important tool. It helps catch problems early, guides treatment decisions, and shows whether your kidney function is improving or declining. If your eGFR begins to fall, your healthcare provider may order more specific tests to understand what is happening. And this brings us to the next method. A test considered the most accurate way to measure how well your kidneys filter waste, especially when precision matters most. The Measured GFR, or mGFR, is considered the most accurate way to determine how well your kidneys are filtering waste. Unlike the estimated GFR, which relies on creatinine levels and mathematical formulas, the mGFR uses special substances that are not produced by your body. These substances, such as inulin or iohexol, are injected or consumed and then tracked as they move through your kidneys. Because your kidneys do not alter or break down these substances, doctors can measure exactly how fast they are filtered. This gives a clear and precise picture of kidney function. The strength of the mGFR test is its accuracy. It removes many of the variables that affect the estimated GFR, such as muscle mass, hydration levels, age differences, or medications. For people with unusual creatinine patterns, those with rapidly changing kidney function, or patients preparing for certain treatments, the mGFR provides information that estimates simply cannot match. It is a more involved process, but the results are considered the gold standard. However, because the mGFR requires specialized equipment, time, and careful measurement, it is not used as often as the eGFR. Most people start with the estimated test and only move to mGFR when a more precise measurement is needed. Your doctor may recommend it if your results are unclear, if you have conditions that affect creatinine, or if major medical decisions depend on knowing your true kidney function. As we bring everything together, it becomes clearer how these tests, along with your daily habits, form a complete picture of your kidney health. Let's close with a few essential reminders to help you protect your GFR and stay proactive about your kidney function. In today's video, we walk through the most important steps you can take to protect your kidneys and support a healthier GFR. We talked about eating in a way that reduces stress on your kidneys, keeping your heart strong to improve blood flow, managing your blood sugar to protect the tiny filters inside your kidneys, staying properly hydrated, reviewing your medications with your doctor, and understanding how tests like eGFR and mGFR reflect your kidney function. Each of these pieces works together to give your kidneys the support they need. But here is the truth. Many people do not hear often enough. Kidney problems often progress silently, and by the time symptoms appear, the damage may already be more advanced. That is why starting today matters. Small choices you make now can prevent larger problems in the future. Your kidneys will not get stronger by chance. They get stronger when you take clear, steady steps to protect them. The good news is that real change does not require perfection. It starts with simple actions. Add one kidney-friendly habit to your routine this week. Take a short walk each day. Choose a lower sodium meal. Drink water more mindfully. Review your medications with your doctor. Small steps make a real difference when done consistently. Remember, everything we share here is for education only. It is not medical advice, and it cannot replace a conversation with your healthcare provider. Before you make major changes to your diet, medications, or lifestyle, talk with a professional who understands your personal health needs. If this video helped you understand your kidneys better, make sure to subscribe to Kidney Health 365 and turn on notifications so you never miss an update. And if you want to continue learning, watch the next video on how to lower creatinine naturally and protect your kidney function step by step.